We're back here with Christina, and who's an expert in speech pathology and brain injuries. And we're talking about aphasia and a different type of aphasia that was referred to in an earlier podcast. But perhaps you can tell me some common changes in swallowing after stroke.
Yeah, so after a stroke, you may have experienced some difficulty swallowing, and that's called dysphagia. About 65% of patients will develop some level of difficulty swallowing after a stroke. And if dysphagia is not treated, it can lead to poor nutrition, poor hydration, aspiration pneumonia, and even death. So it's very, very important to have this evaluated by a professional. So swallowing difficulties can occur in two main areas. One is called the oral phase, which is really in the mouth.
Right.
So you might have difficulty chewing food, moving the food around your mouth, or leftover food in your mouth after you swallow. The other type of phase is the pharyngeal phase, which is the actual swallow itself.
Right.
Your swallow might be delayed or it just might be very weak.
Right.
So between those two areas, you can see all the potential problematic areas for swallowing.
If someone doesn't completely swallow their food, I suppose they spit it out, or what happens?
Well, yeah, I mean, they may spit it out. It may come out of the mouth due to lip weakness. It might not be able to be contained.
Right.
Or the caregiver, when the caregiver inspects the mouth, may be able to take it out of the cheek or out of the gums.
Right.
But if it were to stay in the mouth, it can lead to bacteria.
Of course.
If the person lays down, they could potentially choke on that leftover food and possibly develop aspiration pneumonia.
Right.
So it's very dangerous.
Right. Wouldn't you also get tooth decay with the food that sits in?
Yeah, any type of bacterial infection of the mouth, from tooth decay to thrush. There's a wide variety of infections just from leftover debris and food products in the mouth.
So those people should, or the caregiver should seriously brush the teeth.
Very important. Cleaning dentures, brushing the teeth, brushing the tongue as well, checking the inside of the mouth along the cheeks for any residual food products. Very, very important.
Right. So, it's interesting. I don't use normal toothpaste anymore. I got a dentist to give me a prescription for high fluoride, prescription grade fluoride toothpaste. And that's something for people to think about in a situation like this, because the fluoride will protect the teeth, and so that's something you get from a dentist. You have to get a prescription for this, but that's what I've been using since I had my stroke.
Wow. And even a water pick is a good
water pick
investment.
is also very good.
You can get in some crevices a little bit better.
But wouldn't you have potential trouble with the water going in?
If someone has difficulty swallowing thin liquids, then perhaps.
Right.
But if you're really just trying to irrigate and clean out that mouth, it's really useful to have that high pressure going in there.
Right.
Yeah.
Or one of these toothbrushes that
the
vibrates.
rotating, the rotating head toothbrushes.
Right.
I mean, they have so many different devices now to help keep
but
clean
that's
mouths.
a great idea to do one of these.
Absolutely.
To really make sure that the teeth don't decay.
Absolutely.
Because then the aphasia starts into other stuff.
Exactly, yeah.
So what are the signs of this problem?
So there's a few signs of dysphagia. Some of them are profound and extremely visual, like coughing after a meal. You see someone choking, you see someone coughing. You can likely guess they're having difficulty swallowing. A wet voice, so the person might sound a little gurgly, like they're swimming underwater. Okay. It might be more pronounced when that individual consumes liquids, that gurgly quality to the voice. If someone holds food in his or her mouth for a prolonged period of time, Facial color changes when eating. Someone turns blue. Okay.
I guess so.
Yeah, you don't want to see that.
No.
Frequent or recurrent pneumonias, fevers, becoming fatigued as the meal progresses, weight loss, and even drooling.
Right.
Those are some key signs. Now, some people can present with silent aspiration, which is very scary because a lot of these signs are hidden. But you would see fevers and pneumonias develop if that was the case.
Right. So what is aspiration pneumonia? I had never heard of the term.
Oh yeah, aspiration pneumonia is very dangerous. It's a very specific type of pneumonia that occurs when foreign substances such as a food or beverage product enter the lungs. So instead of the food or the beverage going down the esophagus into the stomach where it belongs, it actually courses down the trachea and sits in the lungs, often in the right lower lobe of the lungs. And this typically leads to a high fever, shortness of breath, fatigue, and some people will require admission to the hospital and they'll need to be on mechanical ventilation. So this isn't the type of pneumonia that you get your pneumonia shot for, that's contagious, that's community acquired pneumonia. This is pneumonia resulting from a foreign body in your lungs.
Your body. Yeah. Right. Okay. So what can you do if you have this problem?
So if you have this problem, likely you have seen your medical doctor and hopefully you've seen a speech pathologist. They may recommend a swallowing test for you, an x-ray type of study to take a look inside. And then the speech pathologist will determine an exercise plan for you. There are specific exercises depending on where the level of the impairment is, whether it's the tongue or the lips, or if it's actually the epiglottis, if it's the pharynx. There are actually exercises for the pharynx. So it's really important because each patient is very unique in this situation to have a very specific treatment plan tailored to you or your loved one. But there are some common precautions we can all take to eat more safely. Obviously sitting upright anytime you're eating and drinking, you really want to refrain from laying down. Okay, making sure at least your head is elevated, very important. And also making sure that after a meal, you maintain this upright positioning for at least 45 minutes. A lot of people want to lay down as soon as they eat. But it's very dangerous, especially if you have reflux at baseline or a GERD. It's very dangerous to be laying down. You really want to maintain this upright positioning. Also taking small bites and sips, okay, not, guzzling down something. Just take it easy, small bites and sips, take your time. Making sure, like we talked about before, clearing all of the food from your mouth. Very important, especially in the evenings. So engaging in good oral hygiene, very important to do that. And if the speech pathologist or the medical doctor recommends a specific texture change, for example, pureed solids, mechanical soft solids, you really should heed their recommendations, as well as liquids. The therapist or the medical doctor may recommend thickened liquids for you. So those are liquids that are not as thin as, say, like a regular water. They have a little bit more body to them. They may be honey thick or nectar thick. And the doctor and the speech pathologist can work with you on a program to hydrate you in that way. So it's really important, if you're experiencing any of those warning signs, to be evaluated by a doctor and a speech pathologist.
For sure. And also it strikes me that you should be going to the dentist on a every 6 month basis.
Yeah, definitely.
Probably have teeth cleanings and things like that.
Absolutely. It's very important.
That's really kind of important.
And if you're having speech problems too after a stroke, if you're having food and debris in your mouth, it's very difficult to speak with anything in there. So you really need to have excellent hygiene. Also for your voice as well. Very important to take care of your mouth and to take care of all these aspects.
Okay, well, thank you, Christina. Really interesting, and appreciate your coming in today.
Thank you for having me.
And